So there's been an outbreak, and these are the symptoms. So I want everyone to figure out what the diagnosis is or differential. So headache, muscle pain, chills, fever, productive cough, fatigue, loss of appetite, and about a 15% fatality. Pretty straightforward, right? Okay. So here's a list of these outbreaks that occurred recently in the news. We have some of this, so maybe that you're familiar with it. So 1985, Stafford District Hospital, 175 ill, 28 deaths. 1999, the West Freeze Flower Exposition, 318 ill, 32 deaths. You see a pattern here already, right? Okay. Melbourne Aquarium, 95 ill, 4 deaths. Forum 28 Art Center, Barrow and Furness in the UK, 172 ill, 7 deaths. Straightforward, right? Playboy Mansion Pool, 123 ill. This is excluding all the venereal outbreaks they probably had. And then Milwaukee Area Hospital in Wisconsin, which is the reason we did this, because it's very recent. In the hotel lobby, they had an outbreak of this that they tracked to delivery people. So, no? Any takers? Any idea of any commonalities? I tried to hide them.
Is it French?
Is what French?
The disease?
Si tu veux. Okay, next.
Because our professor didn't show up today in French.
Oh. So here's one of the cases from this. A case of CR, 48-year-old male in ER with shortness of breath, fatigue, cough, diarrhea, and joint pain. Elevated white blood cell count. And then what does this X-ray show? What part of the body is this, first of all?
It's the thorax.
Yeah.
Good.
Do you see any?
Looks like there's a loss of lung tissue.
Yeah, or...
And there's fluid there,
yeah,
too.
So fluid. So what do you think causes a fluid buildup in lung tissue, or what do you call that?
Pulmonary edema.
Pulmonary edema, and is there any other condition that you could think of?
Pneumonia.
Yeah, pneumonia. So, yeah, what is pneumonia? Because I actually had a very unclear idea of what pneumonia is when we went to hear about it a lot.
It can be either bacterial or viral.
Mm-hmm, but what is it exactly? What is a condition of pneumonia?
It's a fluid collection in the lungs.
Yeah, fluid collection in the lungs and inflammation of the lungs. So pretty straightforward. And then what causes it? So bacteria, viral, what else? We talked about it in some of the other correlations.
Euro disease.
Yeah, possibly, yeah. That would probably fall under the category of bacteria and virus.
It can be
the next one. So it's an inflammatory lung condition, right, with fever, chest symptoms. And then it's caused by infectious organisms or aspiration. So if you aspirate something. So if you go to the next one, do you remember what kind of people are at risk of, well, that's the next one actually. So infectious cases, bacteria comprise 50% of cases, viruses about 33%, and fungi and parasites are relatively rare, usually in immunocompromised people. So what kind of people develop aspiration pneumonia? Do you remember the people at risk?
They have a fistula between their esophagus.
Yeah, that one's good, yeah. Anything else? Remember Alzheimer's?
Elderly.
The elderly, so people with problems with swallowing.
People who can't swallow.
Yeah,
They're very young.
yeah. Good.
How about colleagues? How about Yale undergrads?
People who are drunk and throw up
There you
and
go.
swallow it.
Well, that's a really common thing. If somebody passes out from alcohol, they puke and aspirate.
We'll get to that.
Okay,
I promise.
I'm sorry.
I dedicated a big portion to
Oh,
it.
good.
So it's common in those with difficulty swallowing, ALS, and Alzheimer's. So which lobes are most likely to be affected? I think we talked about this a little bit. The right lobes, right? And why is that? Mm-hmm. If you're standing up, right? So then if you go to the next one, this is true except for alcoholics. Are more likely to have the upper lobe affected. And why is that? Yeah, in what position? What's the typical, yeah, thank you. Face down. Yeah, you can go ahead. Yeah. So obviously, when when you go to Gypsy too much and you have the $2 specials, you tend to vomit in the prone position and you aspirate that. So that's okay, so you can categorize pneumonia as lobar pneumonia, which affects a large and continuous area of the lungs, so a lobe, or bronchial pneumonia, multiply foci of isolated acute consolidation. So it's just basically a global way of separating the two, but there's really not too much difference. So you can go to the next. So which one is this? Is this going to be lobar or bronchial?
Lobar.
And which lobe? I think we have two lobes going on there. Which one?
Is that the left lung?
Lower lobe? I think so. Right. Yeah, but it's the lower lobe.
Mhm.
Okay.
Perfect.
And then on the radiograph, where is this? Yeah, right. I think this is the middle one. Okay. And then how about this? So this isn't lobar, so it must be the other one. And can you show me what portions of the lungs that have problems? Maybe the lighter. I think as Sarah talked about, you actually palpate them and you can feel a difference in those.
Why the lighter?
I think they just filled up with fluid and then I think there's some soda that occurred. I'm not sure exactly what I spiked. I think Sarah touches on some of the... And then here it's obviously more diffuse and it's less lobar appearance. Okay. And you can also categorize pneumonia based on how it's acquired: community acquired, aspiration, healthcare associated, hospital acquired, ventilator associated. So these bacteria, what kind of bacteria or viruses do you tend to get? Do you know? Is this something that's usually, are these rare bacteria that you're picking up, or are these common? Do you think, based on offhand about pneumonia?
They're common bacteria.
Like Playboy mentioned, Pool has them, more other places. Okay, next. Okay, so looking at the histology, do you know which one's the normal lung? The next slide zooms in a little bit more.
The one on the left.
Yeah. And what are these things called?
Alveolar sacs.
Yeah, great. And then what's going on here?
There's inflammation.
Yeah. So these walls are actually thicker as well, and we have some fluid because of the neutrophils coming in. So this is due to some sort of bacterial infection. The next one. Which one's the normal one? Neither. But what's going on here? Do you know what these things are?
It's a neutrophil invasion.
These are hyphae of fungi. Aspergillus. So this is actually a fungal ball that is formed in the lungs. Aspergillus is common in what kinds of patients? In AIDS patients. So immunocompromised. Aspergillus is everywhere, so only if you're immunocompromised are you at risk of really getting it. You do the next one. And then how about this one? Is this a normal lung? No. And this is the same. This is actually from the patient or from someone suffering from the same thing as a patient. So any guesses of what the patient has specifically that caused it? We know it's a pneumonia, right? Caused by something. Any ideas? No. Okay. You good. So the sputum samples were tested positive for Legionella pneumophila and positive antigen test in urine, gram-negative aerobic bacteria. And it's everywhere, and it loves the temperature between 77 degrees and 113 degrees. So they actually have normal values for how much of this bacteria you can have in water, and it's tons of places. So the ironic thing in the last slide I had of the outbreak was there was a hospital that had a fountain that had this. So this is pretty common, so hot tubs. So when we talk about the floral show, they had a hot tub at the floral show. I don't know if it was for the flowers or for the people. You have humidifiers that are part of the aquarium exhibits. And they have these outbreaks from time to time that are usually quite lethal, about a 15% lethality. And one of the more interesting risk factors is if you are a professional driver in the UK and you fill up your windshield wiper thing without windshield wiper fluid but with water, you're 8 times more likely to get this. Oh. And then the pathophysiology of this, the bacteria enter the lung with inhalation, and these are usually bacteria that already live in the respiratory tract. They travel from the alveoli to the interstitial spaces, and it's actually the immune response to the neutrophils and the cytokines that bring extra fluid into these alveolar spaces, which causes the symptoms of pneumonia.
Does pneumonia leave scar tissue after you've recovered?
I think it can. I think it does.
So what was the question, Alice?
Does pneumonia leave scar tissue after you've recovered from it? Can you still breathe like your normal?
Oh yeah, no, you have a lot of recovery. So keep in mind that Eileen said, if you screw up, if you ruin the type 1 cells, you have type 2s that will replicate. So the tissue kind of becomes perfectly normal after. Where it doesn't become normal is if you have a pre-existing problem, like emphysema, which you commonly have pneumonia there, but there they never come back, okay? Because the walls are broken down. Time capsule.
Okay. Thank you, Director. Okay.
Go.
So, all right, guys. So, since Duncan did such an amazing presentation, now we're going to apply some of the things we learned to a very specific case. But in order to meet our patient, we all have to be in a time capsule. Now we're all in a time capsule now. And now the year is 1950. Woo! Great. Okay, all right. Hang on. Okay, this is your patient. Who is this person? Can someone tell me?
I'm not allowed to answer, right?
Okay. A hint. This guy wrote a book called Animal Farm, but it's not actually about animals. Yes, very good. So George Orwell. So you meet him. He's 46-year-old at this time. And he comes to your, and you are all like, a physician in your office, come to your office. He's like, for the past 2 weeks, I've been feeling anorexic, nauseated, and have nice sweats, right? And have a low-grade fever, and I find it really difficult to breathe. So that's symptom of severe respiratory distress. And also, I've been coughing up bloody sputum. Okay, so our goal is to basically find out what exactly does George Orwell have. Okay, next slide. So, good thing you brought your X-ray machine with you to the time capsule. And you take a picture of his, thorax. And because now I can talk to you about infiltrates. Can somebody point to me where his infiltrates are? First of all, is it in the left or is it in the right lung?
Right one.
Okay, all right, good. So is it in the anterior compartment or the posterior lung?
Posterior.
So where do we look at? Oh, this is excellent. Okay, yes, so posterior, correct. So then we describe the lesion as very hazy looking, so that's indicative of infiltrate. Okay. Oh, sorry, bad news at this time. So despite intensive therapy, the patient rapidly cured and died 2 days after admission. Yes. I cried as I typed this. So you begin gross review to find cause of death. Okay, and this is what the lung looked like when you take them out. So here's the right lung, and here's a zoom view of his right lung. Okay, so can somebody point out what the lesion is? Okay, now take this one. Where are the lesions?
I would say that doesn't look normal.
Yeah, exactly. So what is this called? This is called caseous necrosis. Caseous referring to like cheese looking, okay? So as you can see, it looks kind of like a cheese. What it is dead cells at the center of lung parenchyma. But there's another lesion. Yeah, where is that?
Is it here?
No, there's
Or
that.
there's this.
No,
and this.
There. Yeah. Yes, there you go. We got it. Thank you. All right. That's right. So back in the lymph nodes, you also get caseous necrosis. And the term for this is called the Gone complex, where you have caseous necrosis both in the lung parenchyma as well as in the lymph nodes. Okay. Go on. All right. So you take a slide of this lung tissue. I forgot to mention one thing. So you get the lung out, and then you actually have to section the lungs. So you take this huge knife, like about this big, and you like section the lungs out, and then you palpate the lungs. You see you can find areas